you don't go in there as a hospice and give morphine or drugs just to drug people out and then just to kill them quickly. Welcome back to episode 2 of At the Heart of Healthcare, on the go, 20 years in the making. I'm so excited to have you back, Joy, and we're going to talk a little bit more about that today. But I also want to remind you that we are a podcast that's unafraid to talk about your healthcare needs, your concerns, and anything that it might be that you would like to bring up to us. So we're here for that, and that's the kind of podcast we want to be. So today we have our CEO and owner, Joy Ekpo, here. She's going to tell us all about how in the heck did you get to hospice? I mean, you figure home health was going great, and all of a sudden, out of the blue, you just decided, you kind of dangled the carrot last time, but share with us, what were you thinking?
Oh no, you know what? When people say hospice, they go, what? Who is dying? Not yet. Mom or dad, it's not time. My doctor said it's not time. You know, our goal for Destiny was to get that fear out and to create an environment where people know that hospice service is the best type of services that is available today and by then. And what do I mean by that? Hospice is the only care that when you get it, you get the care, the support that you need. Many people thought, am I dying? Is it time? Oh no. The platform for Destiny allow people to come on hospice. Some of them get better. And once they get better, guess what? They understand that they can go back to home health. So that myth or whatever that people think, you know, that hospice, don't say the word hospice, don't mention it. But I can tell you, it provides comfort, it provides support to the patient and the entire family. So that's why we got into hospice services to complement the home health services.
That sure makes sense. And it's such a natural progression. And I'm just wondering, when you got the idea to go ahead and start the hospice part of it, the home health was going very, very well. So as you mentioned, you just thought that it was going to just be a really nice partnership, weave in there nicely. And I think that you've had great success that way, correct?
Absolutely. I have a story. We had a patient on our home health that had end-stage liver, I believe. You know, with HIPAA, we cannot share any patient information here. So it was so hard because this family needed to stay with Destiny, needed to stay with their nurses. They didn't want to go to hospice. But after we finished being right there at night and day to try to help the family ease into hospice services, that was the breaking point. This family literally tell us, can you please add hospice so that other families in the future wouldn't have to make changes. They can stay with Destiny, they can share the nurses if needed, they can continue the care with the team that is already in place. I tell you, that was the breaking point.
What a great testimonial to the home health and where your heart came from when you started the company. And now fast forward 20 years, and to share that part of it, that it was just a natural progression. For those regular people that have not wanted hospice or heard of it, what do you think it is that scares them so much about it?
You know, some of the stories I hear could be true because not all hospice companies understand that it's very difficult to give up. It's very difficult to say it is time. But one thing I want to stress is that at a time, one is born, and at some point, one is going to have to pass on away from this earth. But there is a way for us to present that so it's not scary. You know, some people tell me, you know, the hospice come, they stop all their medication and my dad died the next day. I can understand where that fear is. But please know that hospice has changed. Hospice is for the living, to enjoy whatever is left for them, So our goal as hospice is to bring that patient on. When the doctor has said they have 6 months or less to live, we give comfort emotionally, spiritually, and physically. Having the family and the patient enjoy their lives to the very last day. In their location, home, assisted living, nursing home, wherever they want to end their life. So I believe that what we've been doing with our hospice since 2012 must be eye-opening for people to know that coming on hospice doesn't mean you're going to die tomorrow, because we will all die. But it is a part to provide comfort, respect, and dignity at the end of life.
It sounds like such an amazing opportunity. So then you don't go in there as a hospice and give morphine or drugs just to drug people out and then just to kill them quickly then?
Absolutely not. What we do, we get what we call comfort kit. It's a kit that we put everything that we're gonna need, and we tell the family, keep it for when it is needed. We don't just go out and stop all the medications. We don't do that, because at the end of the day, it's about dignity and respect, and we want to treat our patients and families the way we want our own families to be treated, which is why most of our doctors, people we work with, their loved ones, their parents end up in our hospice because they know the care that we provide. So it has to be natural progression of dying process without expediting it or delaying that process. So that's what hospice is, and that's the services that Destiny provides.
That's wonderful. So that's just a big myth. And I know that there must be so many myths out there about it, and we hear them, and we're hoping that we can demystify that for you here today, because those myths will stop people from really having the comfort in their own home, like you just described, and being able to be there with their family, their loved ones. So they get equipment. You bring in probably the bed and all of those kinds of things, correct?
Yes. Once the family said yes, that they're willing, or the patient, sometimes the patient themselves said, I'm ready to get this comfort care. I'm tired of going in and out of the hospital. Then we work with our medical doctor to get the medication that they would need in addition to what they're already taking. And we look through the medication to see what needs to be discontinued in coordination with the family and the patient. Then the medical equipment, bed, wheelchair, commode, whatever that is going to provide comfort comes from hospice, including medication for pain, difficulty breathing, constipation, anything that provides comfort for the patient, hospice supply does. And for any other diagnosis that is not related to hospice diagnosis, the insurance continue to provide and cover those. Of course, hospice manage the entire care.
So it's no surprise then that a lot of people, once they get onto the hospice benefit and they truly, truly understand it, that families just absolutely love it because of all of that extra care and everything that's going on. And it sure does sound wonderful. Do they have to die in 6 months? Do we make a point of making sure that they're going to be dead right then, or how does that work?
That's interesting, because our current past president is on hospice today, and I'm so proud of him for accepting the comfort and setting that example for Americans. President Jimmy Carter, I'm talking about.
Yes.
So the story here is, nobody knows when a person is gonna die, just like nobody knows when a baby is gonna be born. So when we bring a patient on, every day is a blessing for the patient, the family, and the team. So they live the best of their lives. We keep monitoring this patient every 14 days. So every 2 weeks, the team meet together to discuss the progress, the comfort, and anything that is needed for the patient. They can go on for 6 months, for 1 year, and for so on, unless the team come together to say, this person is doing so well. The hospice care has is actually improving their length of their life, then they're not gonna be dying anytime soon. So time to sign them off. Oh boy, that's a hard thing for the family. To even think that they're gonna lose the team, now they won't get this support. To me, the most difficult part of hospice is telling the patient and the family, we're gonna have to sign you off this service because you are not dying anytime soon. You actually got better with our services. Their family get really sad to lose that support and comfort that they get.
I could imagine, because they're going off or graduating from such an amazing benefit, and to be able to have all that extra support, I could see. So the beautiful thing, though, in your 20-year journey is in having the foresight that once you graduate them, though, you probably are able to put them back on home health, which is wonderful then.
Absolutely, you know, that is why we provide the entire level of home care services. So assuming this patient comes off hospice, we're able to put them on home health. And because we do own medical supplies, we're able to leave the bed and the equipment until they're able to secure this equipment from their insurance. Whereas what I hear some other companies do is they pick up those equipment and the family said, I didn't die too soon, or the patient said, I didn't die too soon, so they pick up all my equipment. That breaks my heart.
Yeah.
But that's why Destiny is different. We're gonna make sure that transition is smooth and that the patient get the supplies and the care that they need through care transition to home health or palliative care, depending on their need. If they don't need nothing, we just tell them, stick around, enjoy life, call us when there is need to be back, and we'll be right back.
That is wonderful. Yeah, because you definitely do hear that oftentimes families are just left with what they're going to do now once they're discharged. And I love the fact that, you know, that the home health is there available. And it's interesting that you talked about Jimmy Carter, because just like him, President Reagan was also on hospice. And what's wonderful about that is we can talk a little bit about the diseases. We know he had Alzheimer's, President Reagan, which was end stage, and Jimmy Carter, of course, with his disease process. Let's talk a little bit more about the diseases.
Okay, so, you know, like our former president that set precedents for us on this, you know, show us that this is a good care, this is real care, and encouraging people to utilize it. You know, most people come on hospice when it is too late. But what conditions do we cover? End-stage cancer, which is when the cancer has moved from one part of the body to the other. And they have exhausted all the treatment, chemotherapy, radiation, nothing else works. And the oncologist said, I would recommend comfort care. That's when we go for hospice. How about the heart? When the heart is too weak to be able to pump and function, to keep life, that's when we bring somebody onto hospice. What about ability to breathe? We call it chronic obstructive pulmonary disease, COPD. What does that mean? When one can barely not be able to breathe, they can move, they have difficulty breathing, they depend on oxygen at home. You know, when life gets there, the support of hospice get right in. Alzheimer's, dementia. That is so popular now, because guess what? Most of our patients live till 100 years, where they don't remember their spouses, they don't remember their kids, they don't know where they are. Guess what? Life can turn into that, but I can guarantee you that hospice care is available to take care of those, support the family, train the family, give the support so they know that they're not alone, you know, dealing with the day-to-day of the loved one going. There are so many other diseases that we cover, but thank goodness that these diseases get taken care of at end of life before somebody passes.
Absolutely. What about someone that has like ALS or Lou Gehrigs disease, and they have a ventilator, but they just don't want to live like that anymore? Would they be appropriate at the end?
Absolutely. That's a very chronic degenerative disease, neurologically, where somebody starts losing the ability to move their legs. It comes up, they lose bladder function, they don't know when they're going 1 and 2 anymore, they can't use their hands anymore. Most of these people even get the trach and vents, they get the machine to speak for them. But when the disease gets to where the breathing is compromised, they can no longer eat, that's the time to come on hospice. Yes, we do. And how blessed we are that we are able to bring these people on with their vents and trach, and then transition them out at home if they need to be around with the family. That's called extubation, whereby somebody was intubated, depending on a tube to breathe, we can do all that at home. So thank goodness that the family is surrounding them. They say what they want to say. They're laying down the bed with them, they're holding hands, and we take the tube out at home, and they breathe their last, and then they leave the earth. What a beautiful scenario that it is.
Absolutely, and I'm so glad that you're able to share that, and that that Destiny really looks after those kinds of folks and all of that. I think what's so interesting is we're discussing our 20 years here, but hospice really hasn't been a benefit that long. And I think a lot of times people, as we talked about it already, are very nervous about the benefit. And do you think it's just because it's only been around since the 80s and they just don't know all of the good things that can happen with this great benefit?
I think we need to talk more about hospice. We need to train our kids that life do end. And when life ends, that's when hospice comes in. No one is going to live forever on earth. We all will have to move on. So it's left for everyone in every health setting, from the hospital to the nursing home, to schools, to teach. I'm so happy that even the medical students now are learning about hospice and palliative care. Awesome. Because if you start with when they're students, then they know how to prepare their patients and families for end-of-life care. So I think it's just the fear, the stories they have heard, what people go through and how it ends. But I tell you today, I hear so many beautiful stories about hospice that I can't even imagine why one should miss such an opportunity to have the support that is there for them at end of life.
Absolutely. And preparing for this podcast, which we love to do, and it's so exciting to be with you all, I was reading that hospice is from the 11th century Crusaders. And the word itself came from that period of time where they were walking at that time, and they would walk from place to place, and they would go to a way station that they called a hospice. And many families would be there all together, and they would be able to go ahead and pass on, and the comfort of being with families and that kind of a thing. And I think it's so wonderful that the wisdom and foresight that came from the founders and then came to America helped with keeping that same philosophy. Even though in America we don't quite look at it like that. And I really like your strategy and ideas of helping people by talking about it more. I do think that you're right. We do need to talk about it more. And I think that this podcast, especially, highlighting the 20 years of us getting here, but more importantly, the vision that you had for hospice. Do you see people, once they really understand it, wanting to have their family members on it more and more? Or do you see people still kind of running away from the benefit?
The benefit for hospice is coming to clarity. Many people are not afraid anymore because most families now know that their loved one may get better just coming on hospice care. So now they look forward to that. For Destiny, we start mentioning and explaining and educating the family, whether they're on home health or palliative care, that there is another benefit that they can get when they're ready. Because people need to be ready mentally, physically, and otherwise, to be able to get hospice care. So it's honestly opening up for the young ones, the elderly ones, grandkids, parents, and grandchildren to talk about hospice. So very soon, I see hospice not being a taboo anymore. People will start asking, when is hospice appropriate? When can grandma be put on hospice? When can grandpa get started? Because at Destiny, we have 30 plus. People that are young with terminal cancers or terminal disease, they come on hospice. They don't need to be in 80s, right? Because it's a benefit that, is good for everyone.
And I love hearing that, because that was the intent of the name originally, coming back from the 11th century and getting a name like that and bringing it. How long can someone be on hospice? We talked about 6 months, but are they broken up into certain benefit periods, or how does that work?
Absolutely. That's a good question, Tony. Okay. So when we first bring a person onto hospice services, they have 90 days. The 90 days, like I was saying before, is every 2 weeks the team meet to discuss the progress, the benefit, what is working, what is not. We want to be sure our patient is getting the benefit of why they came on service. At the end of 90 days, they have another 90 days. So that's 6 months. But that means nothing, because some people have a strong will. They're going to live for 1 year. Whereas with the same condition, some people will only make it 3 months. So 6 months, there's another meeting every 2 weeks. After 6 months, the doctor or the nurse practitioner need to be seeing these patients every 2 months to assess them, to see their progress toward end of life, or if they're getting better, to plan to transition them back out to life. And life could be home health or palliative care. When they're ready, anytime in their lifetime, they come right back on hospice services. It is a lifetime benefit, even though they said 6 months or less, but some people last much longer on a disease condition than others.
That's so wonderful to hear, and I'm so thankful that you're able to share that with everyone out there, because oftentimes people just don't know. So do they have to keep going to their own doctor? You mentioned a team, and then you mentioned a doctor and a nurse practitioner. How does the team work that goes out to see the individual?
The team, hospice is really team, and the family is treated as a unit. So which means patient, family, the entire family is one unit. The hospice team comprises of the doctor, the nurse practitioner, the pharmacist. We have the chaplain, who is a spiritual counselor. We have a volunteer. We have the nurses. We have the caregivers, hospice homemakers. We have the home health aides, the entire team. So we all look forward to the welfare of our patients. So this entire team also includes the primary care physician, the specialists that want to be a part of this. So once we bring patient on, we reach out to their doctors. How do you want to get involved, with their care? So it's a beautiful team that all work together, think together to find solution for our patients on hospice.
Wow. So they're really talked about regularly, and I don't think that oftentimes families knows that. You mentioned the interdisciplinary team and how they meet and they talk, and I think that is something that's very helpful for families, oftentimes, because they are better to get a better idea of how their loved one is actually doing, and the team then probably shares with them how they are and what's going on. Do we visit them a particular time, during the week, or do they get seen every day? How does that work with how how often to see them?
When we bring a patient on hospice, we have an RN case manager who is in charge of that care. The social worker, the chaplain, the home health aide, the volunteer. So the patient must be seen by the case manager at least every 2 weeks. But the rest of the team, we see our patient as their care need arises. It could be daily, it could be twice a day. Wow. It could be once a week. But again, the treatment plan is developed with the patient and caregivers so that they get the care that they need, the care that is going to benefit them. There are some patients that said, I don't want too many visits, just come once a week. But guess what? The patient knows to call us 24/7. Because when they call us, there's a live person on the line to answer their phone, look right into the medical records, and try to manage whatever their needs are for them. So we're available for them anytime. but we go make those visits as needed, what the patient wants, or as the law permits.
That's very wonderful and unique because most agencies have answering service. You're saying you have a live person here at Destiny that answers the phone after hours. That's amazing.
Absolutely. When that phone rings, not only a live person, that is a nurse that is going to be able to know, to look into the medicine, the medical record, and be able to educate the family on what to do. No answering service, then going to the nurses, no. They get the answer right there when they call.
Your family must have just been amazed at your insight when you decided to take the leap of faith and start the hospice part of it and how it dovetails so nicely. And I'm just wondering, the support that your family gives you, I know is very, very important. Do any of them actually help and work with Destiny?
That's a very interesting question. My 2-year-old, I usually say she was the first employee of Destiny. That's interesting. Oh, but I didn't do child labor.
No.
So anyway, my 2-year-old, when we started the organization, ended here in the morning, goes home with us, go to school, came back, did homework here. So my family have all been very involved.
Wow.
My husband managed the finances of the organization. My daughter is an RN, started working for Destiny at 17 from high school. So she became the clinical supervisor and literally led the home health until 2021 when she had to move away. So I have a son who is in tech, computer. He helped set up the initial computer. So every one of my family has been a part of the organization because we all believe in what we do for people and working with the team to get us to where we are today.
Very interesting. It really is at the heart when you think about for this organization, and 20 years in the making and taking your entire family and growing this organization with a vision. It's amazing because it doesn't happen that often. And to take your dream and to make it a reality, and then to be able to talk about home health, now hospice. But in episode 3, we want you to come back because that's where we're going to talk about palliative care and how we got to palliative care. What did Joy think about when that time came and she wanted to start that program? And the reason why I think we're going to be so interested about that, Joy, is it's not a benefit that Medicare has recognized yet. So you are going to be sharing quite a bit about how this came about and what you did for it. But until then, I want you all to know that we can't wait to see you in episode 3. Come back, be with us, sit around the table, get your cup of coffee, and we're at Heart of Healthcare, on the go, 20 years in the making. Thank you so much for joining us. Joy, thank you.
Thank you for having me. And thank you, everyone.